Hey everyone, my name is Emaan Chaudry.
And my name is Danielle Solish, and today you're listening to our 18th episode of Seeing Clearly, a pre-clerkship guide to all things ophthalmology. On today's episode, we will be interviewing Dr. Carlos Solarte.
So a little bit about Dr. Solarte. Dr. Solarte finished his medical training in Colombia in 1994 and then continued his training with a specialization in ophthalmology in 1999. Dr. Solarte also completed a fellowship in ocular diagnosis of the eye from Barraquer Institute and Pediatric Ophthalmology and Adult Strabismus from the University of Toronto in 2005. Dr. Solarte has a master in public health in epidemiology and a fellowship in health system improvement from the University of Alberta. In addition, he is attending the University of Maastricht in Netherlands for a master's in health professions education.
Dr. Solarte has been involved in global health and capacity building for over 20 years. He's been a part of the Flying Eye Hospital of Orbis International, where he has been the Chief Ophthalmologist, Medical Director, and the Director of the FEH. Dr. Solarte has participated in over 60 international FEH and country-based programs as both a staff and an invited volunteer faculty. He is the Residency Program Director for Ophthalmology at the University of Alberta in Edmonton.
So thank you so much for joining us today, Dr. Solarte. We're very excited to have you here.
Emaan and Danielle, thank you so much. I'm very happy to be here.
And we are very excited to have you here. So now that we've gone through the introduction, we're going to get right into the questions. And this is a question we ask to all of our guests. But would you mind just telling us a little bit about what drew you to the field of ophthalmology?
Yes, Emaan, it's a long story because actually that starts from my medical school. I always wanted to be a surgeon. I knew that from I was very little. I wanted to do something that was surgically involved. My dad was a physician. My dad was a cardiologist. So I got to see the medical side very early in my life. But I like the precision. I like the suturing. I like that because I was able to witness that since I was very little. And when I was doing medical school, I always wanted to be a surgeon, and I was thinking about thoracic surgeon. But when I went to see an ophthalmology case and I saw a cataract done for the first time as a medical student, that really dragged me into ophthalmology right away. It was short, half an hour, with incredibly change for the family and for that patient. That patient was totally blind because of very dense cataract. And I was able to see that person the very next day, absolutely happy. So that made me change my life completely, going from thoracic surgery to ophthalmology.
Wow, thank you for sharing that. It's really awesome to see that it was just that one interaction that really changed the trajectory of your whole life pretty much. Yeah. And so kind of getting a little bit more into the details, you're a pediatric ophthalmologist. And so what specifically drew you to pediatrics? And do you mind telling our listeners maybe a little bit about what the day-to-day life of a pediatric ophthalmologist looks like?
Yes, and I have to mention one person here. His name is Dr. Alex Levine. He is a pediatrician, ophthalmologist, and geneticist at the same time. He used to work at the University of Toronto. But I met him before actually being as part of the pediatric ophthalmology team. I was working with him in Bangladesh through Orbis, and I was a comprehensive ophthalmologist. And he made me change my mind because he saw how I was interacting with the children, how I was working with pediatrics, and he looked at me very seriously during lunch one day and says, "Have you realized how good you are in this?" Which I have never even think about. And I started looking into that, and that was in the year 2002, and I started looking into pediatric ophthalmology now as a possibility. And of course, I was working with the Orbis worldwide, and then I decided, this is something I like. And that's when I applied to the University of Toronto for a fellowship in pediatric ophthalmology. And fortunately, I was accepted. And that was what changed my life, because that's actually the same time that I moved to Canada.
Oh, wow.
That's amazing. It's also just nice to see that like these experiences that you've had have like shaped your future career, and like it wasn't necessarily your trajectory at the beginning, but it shows that like there are so many different ways and like paths you can do just within ophthalmology. And so like that's absolutely incredible. And on that like same realm, so you mentioned Orbis already, but would you mind telling the audience a little bit more about Orbis and like the international work that you have done with Orbis?
Yes, indeed. Orbis is a non-government organization that I was able to get to know through one of my teachers in Bogota, in Colombia. Orbis promotes capacity building in ophthalmology, but they also have a plane. It's called the Flying Eye Hospital, and that's two of my passions in life: aviation and ophthalmology. So what better place I could join both of them than Orbis? So that's how I joined Orbis. And for me, capacity building is something that I believe truly in how we need to help others to build the resources, how to build what they do. And I joined the Orbis supposedly for a year, just to see and get some experience. It has been 21 years since that year, and I is still working actively with Orbis. Now, the life in Orbis is pretty intense. It's busy. When you are a staff, you travel throughout the world, I would say 9 months out of 12. And it's really nice to go and see places that number one, you will normally not consider visiting as a tourist. Number two, you go to the real side of where the problems are, not the touristic side. And number three, you learn how different health systems in the world work. But you get to see them and work with them, trying to build the capacity and night care for them. And that's what is interesting about Orbis. It's not about going and produce service, but about to help others to flourish by themselves. And that is the key, because actually it's what any teacher will do. Any teacher will try to make the students flourish, promoting their own strengths. And that's exactly what I was doing. That's what I have been doing with Orbis for all this time. Now, Emaan, if I can continue here with something, you asked me what is the life of a pediatric ophthalmologist.
Yeah.
It's a very interesting, busy one. Pediatric ophthalmology is one of those specialties where we are not many in the country. So our days are busy. But the pediatric ophthalmologist depends where your practice is, in a hospital setting or a community setting. Those are two different sites. In the community setting, you'll see more general children with eye diseases, maybe glasses, need for glasses, some strabismus. Mostly that will be the day-to-day. The life of my life is that I work in a hospital base. I'm a hospital-based ophthalmologist. So my life goes around very sick children, and unfortunately, sadly, very sick ones, because I see patients which have diagnosis from neurology, neurosurgery, genetics, behavior like autism, Down syndrome, arthritis. So my bulk of cases are more complex, more difficult than normally I will see in the community if I will be doing exactly the same in the community. So we do not see the volume that other ophthalmologists will see. We have to see less number of people because we take longer because of the challenges we do when we are examining these children. So but at the same time, I always have a resident with me, always. 100% of the time, a resident will be exposed exactly what I'm seeing. 100% of my clinical time is always with the resident, either in surgery or in clinic. So my residents got the same exposure that I have to my clinical patients.
Well, thank you for explaining all of that to us and our listeners. So kind of wanted to touch a bit on both of the things you were talking about. So a little bit about Orbis and your day-to-day in pediatrics. So you've had a lot of experience working abroad and internationally. Do you mind maybe talking a little bit about those differences in practice you noticed in pediatrics specifically, or in ophthalmology in general, when you were doing that international work, and maybe what you learned from that and what our learners can also take away from those experiences?
We are incredibly fortunate that we have the health system that we have, that is 100% covered, that the people have absolutely access to the highest and the state-of-the-art resources in the world. Other countries do not have that luxury. So in terms of equipment, they may not have it in terms of the resources, but specifically in terms of education. Most of what I have done in the world is not only, is very much similar to what I do here, being program director and very educational leader. When I go to certain places in Africa, I have been working not in the clinical side, but trying to build up how they can do teaching, how they can develop a true ophthalmology program. That is a huge difference. We have an incredibly well-established health systems and educational system. The Royal College has done a fantastic job keeping high standards across the country. Some other places, they don't even have accreditation entities or Minister of Health, they don't do it. So we have to go and build up from what we do, and we take our model and try to introduce to some other places how they can do it. That is the biggest difference that I have seen. Yes. Let me give you another example. Maybe when I went to Cameroon, when I'm doing a strabismus surgery here, I may use 3 or 4 sutures and packages. Perfectly fine. When I went to Cameroon, they told me, hey, doctor, can you mind to use only 1 package, 1 suture? Because we don't have enough for the whole day. So I had to adjust my technique to be sure that I only use 1, not 3, but only 1. So I have to be really conscious about saving every single little piece of my suture, but at the same time, without changing the quality of what we're doing. We have to work in high quality with less resources. So that is something that we learn from the world. We teach them how to do something differently, but we also learn how they survive among all the different difficulties. And we also learn from that.
Yeah, 100%. It's definitely interesting to hear about just like the different resources that our physicians are given access to in different hospitals in different parts of the world. And like you said, like being able to give the best quality care, no matter what the resources and no matter where you are. And like, that's something that's so incredible about being a physician, is like that adaptability and being able to adjust the technique. So thank you for that. Now just like shifting gears a little bit. So as I'm sure like you're aware, with the pandemic, it's definitely been hard to get exposure to, visiting electives or just different ophthalmology programs. So like, would you mind just telling our listeners a little bit about any advice you have on like, going into ophthalmology, how to best stand out as a learner, or like how to become a better learner?
Yeah, and unfortunately, the pandemic may change dramatically the way we behave in teaching, not the way we teach, but the opportunities that we have seeing people from other universities and other programs. Yes, I'm in Edmonton and Calgary. At least we're in the same province, so our province allows us to have Calgary and Edmonton visiting, but we cannot go elsewhere, and other people cannot come to us. That has dramatic impact in the way that we do, and the way that residents also learn, because the electives that our rotations that our residents do elsewhere are also limited. Fortunately, things are starting to open up a little bit more, but we learn different ways. We learn how we can use online resources and how we can connect now the different universities in the country under one roof to do some teaching, and how we have been sharing our experiences. That opportunity, we took a problem and we converted an opportunity to do more inter-university agreements, how we can talk to other ones of our colleagues around BC. At least right now we have UBC, University of Calgary, University of Alberta and Edmonton, University of Saskatchewan in Manitoba. We work and we do grand rounds together. We do pediatric rounds together. We try to, if anyone has a specific guest that is highlighted, we try to share with everyone. That is how we are trying to support that. Now, for medical students which are planning to apply for ophthalmology, it's a little bit more challenging, because unfortunately, the options for visiting electives are pretty much closed throughout the country. And that is, sadly, is the reality, and it's difficult to overcome that. It's different to work very closely with the staff in their own university.
Yeah, I mean, there's definitely challenges, but it is nice to hear, at least, we always think about the negative sides of the pandemic and how we're limited in terms of where we're training. But it's nice to see that you mentioned that inter-university collaboration. That is a positive thing, and I'm sure is beneficial for learning to have all of those universities now collaborating. Otherwise, I guess they wouldn't have. Do you have any advice for medical students that are looking to learn more about other programs across the country, but are geographically limited because they're on the other side of the country or something like that?
Most of the universities, specifically if anyone is in the last year of medicine or is starting to look into CARMs, most of the universities, at least in the Western Canada, are doing open houses. And these open houses happen, and mostly are going to be in November, December, maybe January. These open houses give the opportunity for residents to talk to the staff, even on Zoom, but talk to the staff. Actually, they will have a face of who is the program director or the different teachers. But more importantly, we provide and we try to keep the residents and the applicants an opportunity to talk on a protected environment. What I mean by that, during the open house, we select a group of no more than 8 or 9 prospective applicants to meet with 2 or 3 residents on a Zoom call, but they will be able to ask any questions they want, and our residents will answer them as honest and clear as possible. So what I mean by that is we want to be sure that the applicants get as much insight from the program as we can provide. And some of the questions are more difficult than other ones because we cannot be in person, but that actually helps the applicants to have a feeling or taste a little bit of a flavor what the program might look like, because not all the programs are the same. Programs have different perspectives, and programs may fit the needs of one applicant more than the other one. Mm-hmm. Some people may be more inclined to research, to paper writing. Some other people may be more inclined to surgery or clinical, and there are programs we have that as well.
Right, and that's honestly really great to be able to get that transparency, because it would be very difficult otherwise when you can't visit the program and see that like vibe of that specific program and whether or not it's like a good fit.
Mm-hmm.
And so I think with that, we've kind of wrapped up all of our ophthalmology related questions. So thank you so much, Dr. Solarte, for that. Now we can transition into our more fun segment of the episode. So we ask some would you rather questions. So I'll start off and then Danielle will continue. So for the first question, would you rather buy 10 things you don't need every time you go shopping, or always forget the one thing that you need when you go to the store?
Okay, there is a difference between men and women doing shopping, okay? Men will be like me, will go with one thing in mind to one store to buy one thing. And I'll go directly and I leave the mall as soon as possible, okay? Women will be different because they will be all around. Believe me, I will not buy 10 things. I'll buy 1, maybe 2.
But if you buy the one thing, will you forget it? Is that the option that you're going for?
No, I'll buy the one that I need, believe me, and I will not buy the 10 things that I don't need. Except if I go to Canadian Tire, I always end up buying something I don't need for whatever reason.
Fair enough. Can't argue with that one.
Whereas I think if I went to Canadian Tire, I would go in, buy what I needed, and then leave.
Yeah, me too. But don't take me to a mall. I probably will buy 10 things.
Okay. Remember, Edmonton has the West Edmonton Mall. It's the biggest mall in Canada. It's in Edmonton. Yeah. Over 1,000 stores.
Wow.
I'm guessing you don't visit it often?
No, I don't. Too much people.
And then my question is, would you rather be able to run at 100 miles per hour or have the ability to fly at 20 miles per hour?
I'll fly. Okay. I'm an aviation person. Everything for me is aviation. I have my other side of me is, and then I'm involved in aviation too. I'll be always looking to fly. Even if it's slow, I don't care, but I'll be flying.
20 miles per hour isn't that bad. Then you can fly. So
Yeah, that's fine. I keep flying. I'll enjoy more time flying.
Exactly. Well, with all of that, I just wanted to say thank you so much again, Dr. Solarte, for joining us. And thank you so much to our listeners for listening to this episode of Seeing Clearly, which is our pre-clerkship guide to all things ophthalmology. To stay caught up with everything else iCurriculum is doing, be sure to check out our website at www.icurriculum.com and follow us on social media at iCurriculum. Thank you again, Dr. Solarte, for joining us.
No, thanks to you and to everyone who is listening. Good luck with the CARMS selection process. Just one recommendation for everyone. Be yourself. Don't try to prove who you are not. Show who you are, and that will take you farther ahead in the CARMS selection process.
Thank you so much.
Thank you.